What if applying a simple gel to your penis could make it easier to achieve an erection? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're discussing a new gel called Eroxon. It's now FDA approved for erectile dysfunction and available over the counter, which means you don't need a prescription to try it. So, how does it work? What does the research say? And is it something you should consider? Let's start with how Eroxon works. It's a topical gel. You use a pea-sized amount and apply it directly to the head of the penis. You can apply it yourself, or your partner can do it. Then you gently rub it in for about 15 seconds. The gel creates a quick cooling sensation followed by a gradual warming effect. This change in temperature stimulates the nerves in the penis, which leads to the release of nitric oxide. Nitric oxide is essentially what kickstarts an erection. It triggers a chain reaction that relaxes the smooth muscles and allows blood to flow into the penis, resulting in an erection. Similar to PDE5 inhibitors like sildenafil, tadalafil, or Viagra, you still need sexual stimulation for it to work. Simply applying the gel won't cause an instant erection on its own. Now let's take a closer look at the science behind it. Now, the data that's currently available to the public comes from findings presented at the European Society of Sexual Medicine Congress in February 2023. In this study, researchers looked at 100 men and divided them into a randomized controlled trial. This means that 50 men received tadalafil, a PDE5 inhibitor known to improve erectile function, while the other group used the Eroxon gel. The study was conducted across 11 different research sites, including locations in the United States, Poland, Bulgaria, and Georgia. At this point, the information we have is only in abstract form, not the full published paper. However, based on what's available, participants were asked to attempt intercourse at least 4 times over a 4-week period to determine their baseline level of erectile dysfunction. They were then classified as having mild, moderate, or severe dysfunction using a validated questionnaire called the IIEF. This is a tool commonly used in clinical practice to assess sexual function. It helps us understand how significant the problem is based on a patient's responses. The men were followed for 24 weeks, and researchers tracked changes in their IIEF scores during that time. They specifically looked at whether participants reached what's called a minimal clinically important difference. In simple terms, this means, did the change actually matter to the patient, not just show up as a number on a chart? For example, does a 3-point, 5-point, or 10-point improvement truly make a noticeable difference in real life? What they found was that 61% of men, across all levels of severity, from mild to severe, experienced improvement that met what we call the minimal clinically important difference, compared to about 87% with tadalafil. Now, this isn't meant to say one is better than the other, but it does show that there is a clear benefit in men who used Eroxon. Interestingly, they also looked at a secondary outcome: how many men were able to achieve an erection within 10 minutes. This is where it really differs from pills. First, there's no traditional medication being absorbed into your bloodstream. Instead, it works at the skin level by creating that cooling and warming effect, which then triggers your body's own natural processes to produce an erection. Second, it works much faster. With medications like tadalafil or sildenafil, we usually advise taking them about an hour before sexual activity because they need time to be absorbed and become effective. Another study I found looked at their clinical trial called FM57. This one included about 1,000 men who were randomly assigned to either use the gel or a placebo. The trial was conducted across 60 centers in Central and Eastern Europe and was part of the data used for FDA clearance. In this study, participants again had to attempt intercourse 4 times over 4 weeks to establish their baseline. Researchers then observed a statistically significant improvement in erectile function compared to placebo. And this is important because placebo alone can have a strong effect. We've seen in studies that up to 40% of men can report improved sexual function even with a placebo. Even with that in mind, the gel still performed better. In fact, About 60% of men reported that it started working within 10 minutes of applying it. Now, when it comes to side effects, there were very few reported, and none of them were serious. A small number of people did experience headaches and nausea, but it was only around 4%. In comparison, in the earlier study I mentioned, men who took tadalafil had a headache rate closer to 19%. This gel isn't just approved in the United States, it's also approved in Europe. There, it's classified as a Class 2B medical device under European regulations, which means it can be used without a doctor's prescription. There are also a few practical things to keep in mind. You can safely use it with condoms, as it doesn't damage or weaken them. It's also safe to use during oral sex, meaning it won't cause issues if your partner is exposed to it orally. Another important point is that it doesn't have the same restrictions as some oral medications. For example, drugs like sildenafil or tadalafil can't be used if you're taking nitrates, medications like nitroglycerin that are often used for chest pain. But with this gel, that restriction doesn't apply, so it can be used even if you're on those medications. So overall, this could be a very good option for people who want something simple, fast-acting, and easy to try. But overall, I do think this is a very promising option. It appears to be quite safe, may work for around 60% of men, and doesn't seem to cause whole-body side effects, which is a big advantage. I'm genuinely encouraged to see more treatment options becoming available for erectile dysfunction. And if you're enjoying this content, don't forget to subscribe and share the channel with others. As always, take good care of yourself, because you truly deserve it.